I can't really point to a time when I felt truly affirmed, which I think underscores the persistent challenges in healthcare and the need to work to create inclusive spaces. So my decision to become pregnant already had additional layers to it. Deciding to carry a pregnancy and parent are already huge decisions and scary enough, but I also had to consider the information I know about Black women's incredibly high maternal mortality rates. So when I was pregnant and being seen by a provider, I found myself in a constant state of vigilance, questioning whether I was receiving the best care, whether I was genuinely being heard, or whether I was just another number in the system. When I went into labor, I wasn't necessarily thinking about equity and representation. I was thinking about having a healthy baby. My focus was on the profound task of bringing a healthy child into the world. So I felt like I had great nurses, but during my labor, I overheard a nurse reporting to the doctor about me, and she said, "She looks good. Her vitals are good. She's a BBS." I didn't know what BBS was, and when I asked her, the nurse said, "Oh, it means big, Black, and strong." The nurse said she likes helping with the births of big, Black, strong women, and that the births are generally smoother. How absurd is that to say? What did it mean to be big, Black, and strong in the context of childbirth? Did it mean I wouldn't need as much care or attention? Did it mean I was expected to handle the experience differently because of my race and size? What if something had gone wrong? Would they have offered me the same level of care? Or would they have assumed I didn't need it because I was strong? It's been years at this point, and I still struggle to fully wrap my head around that moment. I'm grateful for the healthy outcome of my daughter, but now that comment and how it made me feel are forever a part of my story, and that's really unacceptable. So years later, my wife and I have decided to have a baby, our second child. We felt differences in how our fertility clinics treated us as a queer, interracial couple. We searched for queer affirming clinics, but it wasn't always obvious, and there weren't a lot of local options. Some places we visited were religious and openly unwelcoming. One clinic actually referred to us as this one and the other one, instead of using our actual names. We eventually found a better clinic, but we always have to be hypervigilant, never knowing if it's our queerness, race, or both that will be factored into our care. We want care that's designed for and celebrates us, not a place where we're merely tolerated. I can't help but think about my own safety, and I'm always questioning the quality of care I'm receiving just because of who I am. Seeing myself represented in the spaces I interact with matters deeply, and not just passive acceptance, but active affirmation of all the parts of who I am. The same principle applies to healthcare. Specific, direct acceptance is vital for marginalized groups. I'm generally really cautious about engaging with the healthcare system unless it is absolutely necessary. I've had so many experiences where I felt that my issues might be related to my identity as a Black woman, even if I can't prove it. That's why I've become intentional, especially as I get older, about seeking out Black doctors, particularly Black women in the medical field. It's not easy, especially when I need to see a specialist.